Clean, intermittent self-catheterization is a procedure in which a flexible tube called a catheter is inserted into the urethral opening. It is prescribed by providers when you have trouble urinating on your own due to issues such as injury, disease, infection, or other conditions. Your providers will have explained how to catheterize yourself and how often to do it. This video will serve as a reminder of the process. It is very important to catheterize yourself even if you don't feel like going. If your bladder is not emptied regularly, it can lead to permanent kidney damage. These are the supplies you will need: soap and warm water for cleaning purposes, a towel, a clean catheter, lubricating gel, a mirror, a basin or toilet for the urine to drain into. The catheter has two sides. The drainage side is the end of the catheter with the bigger opening that the urine comes out of. The smaller side is the catheter tip, which is inserted into your body. It is important to know where you are inserting the catheter to prevent contamination or infection. If you are unsure where your urethra is, use a hand mirror and try to find it prior to insertion. Here is a picture of the female anatomy. The outer folds on both the right and left are called the labia majora. Inside the outer folds are the thinner folds known as the labia minora. The catheter should be inserted into the urethral opening, which is located below the clitoris and above the vagina. If the catheter is inserted accidentally into the vagina or anus, dispose of the catheter and get a new one. Once you are comfortable with where the urethral opening is, gather your supplies. Find a convenient place to catheterize yourself. This could be on the toilet, on a chair with a basin, or on a bed with a basin. Choose a place that will give you the best view for catheterization. Clean the surface area you will be working on and place the supplies on the surface for easy access. Wash your hands with soap and water for 20 seconds. You will need to wash your genitals before the first catheterization of the day and after any bowel movements. Wash your genitals with soap and warm water. Rinse and dry with a clean towel. Place a mirror in front of yourself as a visual aid when self-catheterizing. Remove the catheter from the package using your dominant hand to hold the larger drainage end of the catheter. Do not touch the tip of the catheter or allow the tip of the catheter to touch anything. Apply lubricant gel on the first 2 to 4 inches of the catheter tip. Spread your labia with your non-dominant hand while inserting the catheter tip into the urethral opening with your dominant hand. Insert the catheter gently until you see urine flow, then advance it 1 or 2 more inches, never forcing it. If you feel resistance, pause and relax, then continue to insert. When you see urine, lower the drainage end of the catheter so the urine flows into the toilet or container. When urine stops flowing, slowly pull the catheter out 1 inch or 2 until urine flows again. Once the urine flow completely stops, slowly remove the catheter and throw it away in the garbage. The catheters should only be used once, so you must throw them away after each use. Lastly, wash your hands with soap and water for 20 seconds. Here are some additional tips. Be patient with yourself if you are just starting to self-catheterize. Catheterize when your bladder is not at its fullest. Lay out all your supplies before you start. Wash your hands thoroughly before and after self-catheterizing. Breathe deeply to help yourself relax and stay calm. Find a position that you are comfortable with. If catheterizing in a public restroom, take extra precautions to prevent contamination or infection. Wash your hands before entering the stall, use wipes to clean the surfaces, and use hand sanitizer right before catheterizing. If you have concerns or difficulty using your catheter, contact your provider. You may need a different kind of catheter that could be easier for you to use. Call your healthcare provider if any of the following occurs. You are unable to advance the catheter and no urine is seen. You are still feeling bladder pressure, even after inserting the catheter. You have fever, chills, or sweats. You are experiencing new confusion. There is pain, swelling, redness, warmth, or discharge of pus or blood at the catheter insertion site. You have new abdominal, pelvic, leg, or back pain. You feel burning in the urinary tract. You have nausea, vomiting, or are unable to eat. There are blood clots that look like red or dark brown clumps in your urine. You have red, not pink urine for more than 2 days. There are large red or brown particles in your urine. You have a strong, uncomfortable urge to urinate or bladder spasms for more than 2 days. You produce little or no urine even after drinking fluids.